It's live now.
Thank you. Good afternoon and welcome to the Health Overview Scrutiny Panel. I'm Councillor Ian Holder, Chair of the Health Overview and Scrutiny Panel. Members of the public are invited to view this meeting online. Those present are requested to keep the microphones on mute and only to turn them on when you are called to speak. Members are requested to keep your cameras turned on at all times. Officers and external presenters are requested to turn their cameras on only when you are presenting the reports or answering questions. If you'd like to speak, please write your name and RTS request to speak in the chat function. I'd now like to invite those present to introduce themselves, starting with Councillor Mason.
Councillor Lee Mason, Cosham Ward, Portsmouth City Council, and Deputy Chairman of this committee.
Thank you. Councillor Judith Smythe.
Councillor Judith Smythe, St Jude Ward, Southsea, representing Portsmouth.
Thank you. Councillor Rob Wood.
Councillor Rob Wood of St Thomas Ward in Portsmouth and Deputy Lord Mayor of Portsmouth.
Thank you. Councillor Arthur Agate.
Sorry, I'm muted. Thank you, Chair. Councillor Arthur Agate, East Hants District Council's representative on this panel.
Thank you. Councillor Anne Briggs.
Councillor Anne Briggs, representing Waterlooville and North Stakes, Hampshire County Councillor and Vice Chair of the HOSP, which is your HOSP.
Thanks. Councillor Lynn Hook.
Thank you, Chair. I'm Lynn Hook, Councillor Lynn Hook, Gosport Borough Council. I represent Pure Common Ward in Gosport and also the Mayoress of Gosport.
Thank you. And the officers and external representatives, Susanna Rosenberg.
Susanna Rosenberg, Chief Operating Officer of Solent NHS Trust.
Thank you. And Joe York.
Joe York, Managing Director, Health and Care Portsmouth, Portsmouth CCG. Also representing the Hampshire and Isle of Wight Integrated Care System today as well.
Thank you. And Anna Martin.
Anna Martin, Democratic Services.
Thank you. So we've got apologies we've received so far from Trevor Cartwright from Fareham Borough Council, Councillor Rosie Rains from Havant Borough Council, and Tracy Redman from South Central Ambulance Service. So send apologies. Can I just ask members if any members have any interest to declare? Please put RTS in the chat box and I'll call on you to declare your interests. Is anyone? No, perfect. Next, meetings of the previous meeting. I think everyone's was sent the minutes. Please can I have a proposer and a seconder for the approval of the meeting minutes? Rob?
I propose, Chair.
Thank you. And Councillor Hook? Thank you. Those minutes have been approved. Item 4 on the agenda was going to be South Central Ambulance Service, but they're unable to attend. So we'll move, if you're okay, Susanna, we'll move to item 5, which is Solent NHS Trust update. Over to you.
Yes, certainly. Thank you, Councillor. So the focus of our report obviously has been on our Omicron response over the last few months and how we are supporting the pressures at Portsmouth Hospital. And obviously you know that those pressures continue because Tracy unfortunately can't be here today to talk about SCAS. So we are, as ever, utilising additional capacity at Jubilee, thinking about how we can support Home First, working very closely with Portsmouth City Council, very effectively with Portsmouth City Council, and doing everything we can alongside the vaccination programme, which obviously we stood up in response to the Omicron wave to get the boosters out, and we continue to provide all sorts of outreach opportunities to get people vaccinated in the city. So I'm happy to take any questions on the report.
Anyone have any questions? Oh, Judith.
Just a very brief question. Do you have a lot of current vacancies in staff, firstly, and second of all, are many of those to do with the people resigning because they weren't willing to be vaccinated, and what's happened since that that regulation has been lifted?
So none of our staff have left as a result of that compulsory vaccination notice, which obviously then was rescinded. We were being very careful not to go forward with any formal action, so we're pleased that we haven't lost anyone. We do have quite a high level of vacancies, particularly for registered nurses and allied health professionals, physios and OTs. We are fortunate that we've been really successful with international nurses from India and Africa, and we continue to welcome those people into the city. We're now on our 4th cohort, and we will continue to do that. Unfortunately, I think the situation in Ukraine is possibly going to mean that we might not be able to be to pursue that quite at this moment in time. But yeah, we do have vacancies. We're constantly out to recruitment, and that's something which is the case for Southern Health as well and for PHU.
Thank you.
Thank you. Does anyone else have any questions? No. Thank you, Susanna.
Thank you very much.
All right. Next, we'll move to item 6 on the agenda, which is Portsmouth CCG and Healthcare Portsmouth. So, Jo, over to you.
Thank you. And I've also provided within this report an update on the integrated care system development, which, as you know, is still making its way through the Houses of Parliament. And we're expecting that to be resolved and that the integrated care system for Hampshire and the Isle of Wight, like all integrated care systems, will be established on the 1st of July 2022. So there's an update in the report around the work progressing in advance of that date. As Susanna's mentioned, we are continuing to work very closely with all system partners to support Portsmouth Hospitals Trust, and we're continuing to see considerable pressures there and an increase in COVID admissions as well. Again, not unique in this area, but the South East does seem to be having higher COVID numbers than elsewhere in England and the England average. There is some more detail also in the report around primary care and the work we're doing to support practices in resilience, and some specifics around some of the estates issues and new builds that are quite exciting going on in the city. Also provided a brief update in dentistry, and happy to talk more about that. And we've also provided you, if that would be helpful, and we've also provided you with quite a detailed update around COVID vaccination uptake rates in the city as well. So happy to take any questions on the report.
Councillor Wood, I think you had a question.
Thank you, Jo. Just so as a member of the public, so I can get a picture, as obviously we're aware that COVID rates have gone up, and to some degree hospitalizations have, but it's not reflected, if you like, in the more serious death yet. So trying to judge what this looks like, bearing in mind we seem to have taken the sting out of it, if it makes sense. Does this look like what we'd have a yearly cycle of flu? Because obviously at one time flu was quite serious, but now flu has become something we have to manage. So I'm trying to understand the context of the COVID story. I understand the worry, but what I'm trying to understand is it manageable in the same sort of context?
That's probably quite a difficult question for me to answer, and possibly Dr. Helen Atkinson, the Director of Public Health for the city, would be better placed to answer that element around, are we going to see annual cycles? Is it going to be seasonal in the same way as flu? I think my understanding is that is what we are expecting, but how different, how significant, how intense, I don't think we know yet. Certainly there is a lot of work going on, and as you know, we're all trying to get used to living with COVID. You're absolutely right that we're not seeing the high numbers of mortality, and we're not seeing high numbers of people in intensive care. What we are seeing is, so that's really positive from where we were, and shows the strength of the vaccination programme. I think what we are seeing right across the board is increases in admissions of people with COVID, not necessarily because of COVID. So people might be coming in for something else, but also have COVID. And the NHS is still operating quite strict restrictions and infection prevention and control measures around that, which of course means managing those patients with COVID is more complex than otherwise. But in terms of the longer term predictions around how this will play out, I think there's still a lot to be worked through on that, but I'm sure Helen would be much better placed to answer that with more surety than me. Thank you.
Right, that was good for understanding your operational hat as you currently understand it. So I'm assuming ongoing, we will continue to make sure the vaccination program is really pushed very strongly as a regular thing, because that's, if you like, broke the back. I'm just trying to understand where you're going to put the emphasis ongoing, that you think operationally, because you've obviously got a plan ahead, even though you may not know how it's going to turn out. So is that where the emphasis will be?
Yeah, so we continue to do COVID modelling both nationally and across Hampshire and the Isle of Wight to understand the impact of the demand, particularly in relation to the acute hospital services. So that modelling is just being refreshed, and it looks like we'll continue to see this peak, this increase sustained for the next few weeks, although then expecting to tail it off. It is early days because obviously before we've always had the restrictions in place that's impacted on the modelling. Now we're not operating in that same space, so the modelling is continuing to develop, and again the public health team would be better able to answer some of those specific questions for you. In terms of in relation to the vaccine, we're absolutely providing an evergreen offer, if you like, so that ensuring that vaccine is always available. I think the way we've operated the vaccine means we can scale up and scale down as we need to, and we've seen how successful that has been. And as Susanna mentioned, we probably have about 80% coverage, but we have a hard to reach group in the city where we're continuing to work differently with those local communities to see how we can how they might access the vaccine, because it's not just about how near it is to you, and we're exploring lots of different ways working with local community groups, and Susanna's team have been integral to that, as well as the City Council Public Health team and our primary care services as well.
Thank you.
Thank you. Councillor Smythe.
Thank you. What we heard at full council this week was that 50% increases in the number of hospital admissions of people with COVID, but not the same proportion needing intensive care, and 75% increase in the community. It's really an enormous bulge at the moment. What I wanted to ask, though, was about dentistry. There's a terrific amount of concern about dentistry and people not being able to get NHS dentists in Portsmouth, and we've had one or two closures of dentists that have caused problems. But we've actually had questions in full council about that, and I wondered what the latest was and how we could make it easier for people who can't. And I met somebody the other day whose family just simply don't have the income to pay a private dentist, and yet they were the only places they could go, and that includes a grown-up child with learning difficulties. I mean, really, we just are going backwards and backwards on this. And how can what sort of plans are being made to provide more NHS dentists?
Yeah, so it is quite a complex area, which I have to be honest, I'm learning fast about. I can see Councillor Agate waving.
Councillor Agate, did you want to come in?
Yes, Chairman. In fact, I put a question to Anna last week because I'd asked the same question And when I had
You're on mute, Councillor Gates.
oh dear, yeah, okay, there's always one. Yeah, I actually sent Anna an email last week with a number of questions, but it's easy enough to put it here. When I went to my dentist, I've got to see him again tomorrow morning, so I'll tell him how we get on. And said, what's going on? He said, well, the lack of funding, the net government spending on general dental practice reduced by a third over the past decade, the national crisis, official figures in March 2020 showed a 26% of new patients could not get access to an NHS dentist. This was worsened by COVID, over 20 million dental appointments lost since the start of the pandemic. British Dental Association members' survey of May last year said almost half respondents intend to stop working within NHS dentistry in the next 12 months, and 2/3 estimate they will not meet the 60% target set. They say that the root cause of this are the 2006 contracts, and that this and the disparity between public and private sectors. Their comment is that they must reform the NHS contract, which is the major driver of dentists leaving NHS dentistry, and a new contract focused on the oral health needs of patients and target improved access and preventative care should replace it. Dental practice have been asked to deliver as much care as possible, prioritising urgent care, particularly with vulnerable groups, and delay planned treatment for those in the need of acute care. That's a pretty fair mouthful considering the state of dentistry and how many dentists Portsmouth has lost. I'm keeping my fingers crossed that my dentist stays NHS. End of comment, Chairman.
Thank you, Joe.
Yeah, so I think as Councillor Agate has sort of presented, it is quite a complex and worrying position. So the NHS, the contract for NHS dental services sits with NHS England, and there is a national dental contract. And that has been up until now managed at a regional level by NHS England. So for us, the South East region, that will change with the establishment of the integrated care systems, and the responsibility for commissioning dental services will move to integrated care systems, although the national contract position will remain. And that's similar for primary medical physicians, primary medical care services, optometry and pharmacy. They're all sort of national contracts, and there'll be a bit of a phase transition. The team is quite small. I think the regional, the NHS England regional dentistry commissioning teams are fairly small, and they cover a wide area. So under the new arrangements for the ICS, that will enable more local ownership and understanding of the issues. But that will take time, and probably it won't really see many impact of that until April 2023. And Portsmouth, and there are some specific issues across Hampshire and the Isle of Wight, but also in Portsmouth. So I think all Portsmouth councillors and the MPs for Portsmouth have been really vocal in this and raising this issue. And actually, I was part of a meeting organised with Penny Mordaunt MP for Portsmouth North around going up to meet the Minister for Health, and NHS England were there, and the real recognition that they need to make those changes to the contracts. And that's been ongoing for some time. It did stall through the pandemic. They are very much getting that work up and running again now to resolve those national contractual issues, because they they are quite significant. The other issue is, as Councillor Agate has pointed out, the infection prevention control restrictions for dentistry through the pandemic meant I think they lost something like 60% capacity because they just couldn't work in the same way, and the way they had to clean down the surgeries between patients, etc., and the infection prevention control measures in place, it really impacted them, and at points they weren't operating either. So that has had a significant issue, which is nationally. When we met with the minister, the intention was to relook at some of the infection prevention control guidance that were in place for the NHS. Obviously, we then went into the Omicron wave coming through, so some of that work again was delayed, and I think they're continuing to look at how do they manage that now and what are those infection prevention control restrictions. So that's hopefully a bit more about the national picture. Locally for us, we have a number of issues, and one of the challenges is that there are a lower number of commissioned dental services in Portsmouth than there are in other places. So if you add that issue around the loss of capacity during COVID, we didn't in Portsmouth, we've had a shortage, so there's been less, the provision commissioned has been less than it should have been, and significantly less than in some areas. So that's one issue. There are some perverse incentives within that current national contract, I think, that are well sort of documented and understood, that do mean it's more difficult for and harder for NHS dentistry to be sustainable in a deprived area than it perhaps is in a more affluent area, which again impacts on Portsmouth. And then the other issue, and again Portsmouth isn't alone in this, it's a significant issue in the Isle of Wight as well, is around the actual dental workforce, and where do you get them from, and in the Isle of Wight they do have the right amount of commissioned services, but actually they don't have the dentist to provide the service. So they have one element, we have a bit of a a protracted issue in the city, if you like. We have met with NHS England, as I said, because of the nature of the concern, and we have agreed with NHS England to fund a joint post that will sit with the CCG, but also work very closely with the NHS England team and the public health team in the city, to work not just in the city but across Portsmouth, South East Hampshire and the Isle of Wight, to look at what we can do to work with dentists differently. And we're calling that a dentist transformation programme manager or a dentist improvement manager. We're out to advert for that role now. It's a temporary post, it's a 2-year post. What we're hoping is that post will work really closely with the university, because the university has, and I'm always in danger of getting these two slightly mixed up, the university has a dental academy which isn't a full dental school, so they sort of do some of the postgraduate training and they train dental nurses, etc. So but they're not a full dental school, and we know studies show that most dentists will, like other professions, tend to train in a close to where they tend to work, at least for the first 5 years, close to where they train. We don't have a dental school in the southeast, the nearest is Kent, so we're looking to work with the university and Health Education England to see if we can strengthen the university's position in relation to that, because that will be really important, I think. But also looking at workforce development, what are the options to move to other roles? Are there more that nurse practitioners can do to provide particularly some of those health checks for dentistry? How can we work? Solent provide community dentistry services. We also have acute secondary care dentistry. So how can we work more closely with those providers and the NHS dentists to really look at how we can support them and what would make them stay in the city, and how can we work differently? And the reason we're doing that is because we think there's a real need. We think we could do some sort of, learning from the vaccination work. We could do some pop-up health checks potentially that might be quite useful for families, certainly focusing on the looked after children. And we also know that when NHS England have commissioned additional places, dental services, because there's been a lack of provision in the city, that has ended up being commissioned elsewhere. So it's about how do we strengthen the provision locally, and work with those providers where there may be some quality issues, because again, it's quite hard to do that from NHS England. And it will really, I think, be about us working with them and trialling working with them in the way that we work with primary medical care and GP practices. So that support offer. We have got a new practice due to open, but again, it's how do we support that in the context of everything I've just said. So that post will come. We'll hopefully, we're out to advert at the moment. We've had some inquiries. It will be working very closely with NHS England, but really focused on that sort of local improvement as best we can. So that's where we are with it at the moment.
Thank you. Councillor Smythe, did you have anything to add? Councillor Briggs.
Thank you, Chairman. My question's not really about dentistry, but I just would like to say that in Waterlooville, we're all just outside of Portsmouth. There's not a single dentist on NHS that anyone can go to. And you mention other outside, perhaps a nurse or someone, because I know 2 people who've now got mouth cancer, which is just not teeth. That dentists do pick up other things, and I listen to all what you might be able to do, but it really is dire for people at the moment. And I hope looked after children in Portsmouth get priority, do they?
Yes, we have done quite a bit of work to ensure that absolutely does happen, and it is a really difficult position. I think everybody recognises it's not where we want to be, but as I've tried to explain, there are a number of challenges and complexities that are really making it very difficult to make those improvements. But as I say, Penny Mordaunt has absolutely been taking that right up to the Minister of Health for Dentistry and trying to show, and I say I think that is working. I think there is a lot going on around the national contract, and I think what we would aim to do is to really work with Health Education England and Portsmouth University to do what we can to turn that academy into a school. That means we can perhaps have a long-term plan around some of those workforce challenges, as well as doing what we can in the more immediate sphere as well.
Yeah, I think, though, somebody's already mentioned it, if you can afford to pay, I could get an appointment tomorrow. And that is just what doesn't seem right. But actually, my real question to you was, and someone from SCAS isn't here, but it's very concerning the length of time that the ambulance service is losing because they can't get patients into hospital. So what's happening with your discharge? Is this the problem, because you can't get people into step up or step down homes, or?
So it's a multifaceted problem, and I think our plan, I've talked before to the committee about, and our plan, I talk about our plan, it is a all partner plan across Portsmouth and South East Hampshire. So that includes the ambulance service, the hospital, Portsmouth City Council, Hampshire County Council, both CCGs, Portsmouth and Hampshire South and Isle of Wight CCG, Solent NHS Trust and Southern NHS Trust as well. And we have agreed a very sort of, it's a 14-point plan, but it's broken down into 3 sections. And one is about avoiding people getting to the hospital, so reducing ambulances, conveyances to QA, by using different alternatives, so urgent treatment centres, urgent community response services, utilising our primary care clinical assessment services to divert ambulances, we've got a number of actions and schemes underway through that. We had been seeing an improvement in that approach, so reducing the numbers of people going to hospital. With the COVID increases, we are starting to see that that's increased again. So again, we're continuing to strengthen those alternatives and make sure that different pathways the use of that different pathways is really embedded. So that's the first element. The second element is reducing admissions and improving the flow in the hospital. So the trust have developed an emergency care centre, and they've increased the number of care spaces from 30 to 50 since November. So it only came online in November, and that's increased since then. They are operating different approaches, so a re-engineering of the front door into the hospital, which means people are able to go straight into specialty assessment rather than going via the emergency department. Going into same-day emergency care rather than being admitted to a bed. And again, and they've had a new medical village and additional ward spaces. Lots of work going on in there, and we were starting to see a little bit of improvement. But again, the increase in COVID admissions has meant we're not seeing as much of that, and we're struggling to keep those same-day emergency care services open all the time because they're having to be used for beds. And then, of course, there is the discharge element as well, and we have a number of pathways around discharge. There are some patients who can go straight home, and the majority of those do, and that's within the gift of the Hospitals Trust. However, we are seeing patients with increased acuity, which means the length of stay is going up for those patients as well. And then we have the step down facilities that are operated between Hampshire County Council and Southern for Hampshire, and Portsmouth City Council and Solent in the city. And we do have some variation in how effective those pathways are. I think we are fortunate in the city that the level of integration means we're not seeing the high level of delays for some of those complex patients in the same way. And we are able, as Susanna said, the work we've been doing around Jubilee and the South Sea unit between Solent and the City Council means we are able to get people home quite quickly, despite some of the challenges. Hampshire, they are struggling. I think, again, the pathways home are good, but there is some domiciliary care challenges that are really quite significant. And there are more complexities around those complex care. So there are a very small number of patients who are staying longer than we would want them to, and so lots of work is being done to look at how we reduce that. So there's a clear plan. We are under a lot of regional and national scrutiny. The trust is getting national support as well as we are to assist them to work through some of this, and we spend hours on the day really looking at what we can do differently. What else can we do? How do we make people move through that system more quickly? And it is just about embedding those new ways of working, I think. But the COVID pressures and rising admissions hasn't helped, and it does mean that it's not just the number of people in hospital with COVID, it also affects a broader range of the beds, which makes it more difficult for the wards to manage people and get people through quickly.
Jo, that's a very comprehensive reply. I'm not in a way being critical, I do understand, but that is, whenever you hear about ambulance queuing, it's always because patients aren't being discharged in time.
I think it's part of it, but it is more than that. It is about who arrives, how are they managed through the hospital. Are we really sure that we're only admitting people that really need to be admitted, and are we using all the huge range of community alternatives that we've got as effectively as we can? And we've still got more work to do in those areas as well as discharges.
So when we've got the new ED, it should all be solved, should it? Sorry, I'm always cynical.
I would really hope. I mean, how hard everyone is working together to solve it. You know, we need to solve it before then. I think it would be wrong to say we can wait until then. It's not. We're not getting the right outcomes for our patients. So we have to keep on doing everything we can to solve it as quickly as we can.
Thank you, Jo.
Thank you. Councillor Hook.
Thank you, Chairman. Just two things very quickly. I did try to put something in on the chat, but it wouldn't register, just to let you know. That was, I'm not declaring an interest on the vaccinations, although I'm still heavily involved in Willow Group, because it was a general thing on vaccinations. Last time it was about the Willow Group, but I couldn't get it in on the chat, just to let you know. And the second thing, going back to the dentist, I brought this up months ago at one of these meetings and asked a question on were any records kept on what was going on during the COVID lockdowns, and I had a message come back after the meeting from the lady concerned to say, and I was very surprised that no records were actually kept of what dentists were open, who was closed, or what was happening. And I agree with Councillor Briggs, it's more than just the dentist. You know, they pick up so much more. So yeah, we just need to get that sorted out with the dentist, and I don't know how we're going to do it, but it is just so important. Thank you.
Yeah, thank you. Obviously, I can't really comment on that because I think, and because it is NHS England that commissioned that and would be responsible for that. I think as it moves to more locally within the integrated care system, it will perhaps be easier to get a handle on that. And again, through the post that we've established, we would want to try and think about how we can have a greater understanding and greater relationship with those local dentists across the patch, not just in Portsmouth, but for South East Hampshire and in the Isle of Wight.
Thank you. Councillor Agate.
Thank you, Chairman. A couple of items. One was that I was hoping that somebody from Portsmouth Hospitals University Trust would be here and give us a progress report. The minutes last time pointed out that the UTCs have not been pulling their weight, and of course you'd like to ask if there've been some progress on that. That obviously from Dr. Knighton and Chris Evans.
Yeah. So again, I don't know that the Hospitals Trust were down on the agenda today. I think that they're in the next cycle. We continue to work really closely on this. We have 3 urgent treatment centres across Portsmouth and South East Hampshire. The St Mary's treatment in Portsmouth, the one in Gosport War Memorial, and Petersfield. I think we are continually hampered in all of our improvement attempts, and I probably didn't say it as part of the system pressures thing, but staff vacancies and staff absences because of COVID, because of sickness, is significant. And I think that we see that particularly in the urgent treatment centres where they are quite small teams, and we've continued to see that problem. The work that we've been doing with them is to look at how they can support each other, and also how they can take more conveyances from ambulances, and we're seeing some improvement in that, but not as much as we would like to. So we're continuing to work with them and the Ambulance Trust on that. We are continuing to work with St Mary's Treatment Centre in the city to get their opening hours back to 10 p.m. And a clear plan in place to do that. Again, it is staffing dependent, which has been one of the issues and the challenges. We're also working closely with the UTCs and our primary care services as well to see how they can support each other, and particularly in Petersfield, where they do have capacity to see more patients, they are piloting some. They're due to start piloting some work with practices in that area to see how they can better support primary care as well. And if that's successful, then we could look to roll that out. But it is very early days. We're also doing more to look at what's the long-term model, because if we're not utilising the UTCs effectively, then we need to think about a different approach, and we're doing that longer term piece of work and thinking in partnership as well.
Can I chip in on that then, Joe? Having been attended Petersfield UTC, myself and my wife, and what was always seemed a leisurely stroll through, and the impact is that they are not being pushed. Then you come around to the fact that how many people actually know in the Petersfield and surrounding areas that there's an urgent treatment centre in Petersfield. I mean, I knew about it because of this panel, but I've never actually seen that advertised or that point being put across. You can come here for your urgent treatment.
Yeah, so yeah, and I think, and I forgot to say actually, we are doing quite a bit of work on the urgent treatment centre and the communications around that in each of those local areas. I think it's quite interesting actually, when St Mary's changed its hours, we did some communications around that, and it had a bit of an increase for a while, and then of course that, you know, so there is definitely something about our communications, and I think it's something we need to keep going at again and again. And we are, our comms team for Portsmouth is working through that and looking at some videos and some different ways we can do some of that communication, and also again, you working with the ambulance trust to make sure that they are taking people there who can go, and again that patient education from that route and from 111 as well is really important. So we are continuing to do all of that.
Sorry, I was thinking along the lines. I mean, I think my last visit there was with the youngest grandson, who's a 16-year-old rugby player who tends to throw himself in far too deeply and ends up at the urgent treatment centre. But I knew it was there, and it was easy enough to whip him in the car and drag him down there.
Yeah,
it's kicking and screaming, but nevertheless. But so it's the other advertising point is schools, colleges, churches. You know, they're all there. They're all available. If you can flood them with information, you will spread the word.
No, absolutely. And the other thing that we're looking at is called a waitlist app. So it again is an app that provides people with information on waiting times on a number of NHS services. And again, that might be really successful. But yeah, we can certainly look at how we can provide you with more information around what we are doing about some of that communication and engagement, if that would be helpful, because I know it's an issue in a number of areas, isn't it? And we've talked previously about that in relation to primary care as well.
So, Chair, can I just quickly come in on that point? We know Councillor Lee Mason is waiting. Just very quickly, Joe, what would be useful on that communication is where people are going in, you know, the emergency or wherever currently now, having a big sign there that says you can get treatment here would be useful, because sometimes people go in, there's a long queue and there's nothing there to redirect them. So redirecting them in an obvious place where they're already visiting is a great way of getting them into a different habit.
Yeah, and I think the waitlist app also helps with some of that and signage. So yeah, again, some of that is specific onto the hospital, but I will definitely, I'm sure they've done some of that, so I'll get Hayley, our comms lead, to check that, and again we can perhaps provide an update of what we are doing around some of that communications and engagement, and how, you know, how effective it's being or not.
Yeah, that'd be good, thank you. Councillor Mason.
Don't anybody tell him he's on mute.
Councillor Mason. Oops. No. Councillor Mason's no. Any luck, Lee?
I'm trying a different machine.
We can hear you now.
We heard you then.
Okay, can you hear me now?
Yes, we can hear you.
Okay, the William BT Dental, I can see you shaking your head, Arthur. The William BT Dental Academy at University of Portsmouth, whilst it might only train dental hygienists, dental nurses and dental therapists, it has had a long-standing collaboration with the King's College London Dental Institute. So their third-year dentists will spend 1 week out of 4 down here on a rota. So there's always a large number of dentists coming down. Admittedly, there wasn't during the COVID lockdown, but we've got a large number of dentists come down who do their training for the year in Portsmouth, do get to know the area. So there's a hope some of them will stay. And I will declare an interest that, like many of the councillors and officers I always seem to see in there, I've been one of their long-term patients. So it is good to see new dentists being trained in Portsmouth, and I think it does give a seed for the university to go further in the future. I know they're already doing masters in dental restoration and other things. So I think that is a good news story, whilst there is a bigger picture of a problem.
Yeah, thank you, Councillor Mason. You know, our public health department work really closely with the university as well, and again, we're hoping that this new role will just give us a bit more capacity to keep having those conversations and keep thinking about what could we do and strengthen the current position, and you know, is there an opportunity to get them to come 2 weeks of the month, or how might we do that, recognizing all the constraints that we've got. So yeah, I think there are definitely some things we can do locally, but there are some national challenges, as we've said.
Thank you. Any other questions?
No.
Councillor Briggs?
Thank you. It's really just a comment going back to Councillor Agate on urgent treatment centres. I've been to visit Petersfield. I'm not sure, do you run Petersfield? I'm not sure if you are the provider for
No, I'm not. So I work for Portsmouth Clinical Commissioning Group.
Yeah,
it's provided by Southern Health Foundation.
Yeah, I thought it was our area. But my comment, and it might go to other places, is that when people see a sign to the hospital and it says no accident and emergency, but it could be a UT, an urgent treatment centre, how do people differentiate? You know, people haven't got a clue what is urgent treatment, what is an accident or an emergency. They treat some things but not others. I think Petersfield's working well, but it's not up to capacity, partly because they don't have x-rays open at all times. But you do need to make it clearer what you actually do.
Yeah, no, I would agree with that. And we used to have a plethora of minor injuries centres, minor illness services, walk-in services. Nationally, they have moved to the urgent treatment centre and an emergency department. And interestingly, I'd live in Gosport, and I was driving around, and it was a red sign with urgent treatment centre in Gosport, directing you to Gosport War Memorial. So some of those changes are clearly catching up. I don't know about Petersfield, but that again is something we could perhaps look at with working with local authority colleagues, and again simplifying that landscape. We've been trying to do that, and again the communications around what can you go to Petersfield for, because it's the same as you can go. Well, actually, there because Petersfield is a relatively new urgent treatment service. They are still getting fully up to capacity, which again causes some challenges in that simplistic or simplifying the communication. So I would need to double check that they do have that full range. at Petersfield that they do at St Mary's and Gosport, because there was some issues with some of the diagnostic capacity, which again we're working to review and resolve.
I understood that had been resolved and that had improved. Yes.
Yeah, I think it has. I'm just a bit anxious of saying it definitely has, because I haven't checked on it for a while, but I can definitely check and come back to you with the clarity on that.
The only thing that hasn't improved around there is the parking. I can't see that change.
Yeah, that's an issue everywhere, isn't it? I think.
If I may just make one comment, that the one good thing when it hasn't been up to capacity is people have said how wonderful that somebody has actually listened to them for 20 minutes and not the 5 and shoved out the door. So it has had some good news from that aspect. People have been very pleased with it.
Yeah, no, there is some really good feedback from Petersfield and all the UTCs as well.
Thank you. Any other questions from anyone? No, that's the end of the meeting then, I think.
Thank you very much.
Thank you.
Thank you. Bye-bye.
The next scheduled meeting is Thursday, the 23rd of June. So I know some people, I know Rob, you're standing down, so this will be the last time you appear, and I don't know whether anyone's up for election. I know Judith is.
I am.
Anyone that is up for election, good luck.
Thank you.
And thanks for your contributions. Thank you.
Thank you.
Lovely,
Bye-bye.
thank you.
Thank you.
Right.
Thank
Thank
Bye.
you. Bye.
I'll turn the
Have a
live
good
stream off.
weekend.
Thank you.
Thank you.
And